We go to Nosode Repertory proper. Herring told during an acute epidemic infectious disease, several people are affected with that virus or bacteria or parasite. They develop clear-cut, intense, characteristic symptom complexes, symptom chains. The most common thing we all had seen, dengue fever, and it has stages. Initially, what large number of people will suffer? Stage 2, what commonly happens? Stage 3, what are the different organs affected and what will be the symptom complexes? Then we have seen the effect of coronavirus. One moment. Please. Corona. What were the initial set of symptoms in large number of people? Stage 2, what happened? Stage 3, when different organs are affected, what was the effect? And what will be the complications if patients are already suffering from some other disease with or without medications? These are vivid examples we all had seen with our own eyes. So typhoid is one common pattern, malaria is one common pattern. The eruptive fevers that are more common in summer, the chickenpox, measles, and sometimes the mumps also. So these intense acute infections produce clear-cut characteristic symptoms on several individuals, and most of them carry very common symptoms that is characteristic of that disease, plus symptoms due to individual variants, particularly depending on the individual's genetic constitution, past illnesses, and the state of immunity. Present medication or not, the lifestyle, habits, living environment, and all these will contribute for the individual symptoms of that person affected with an acute infectious illness. And Herring put it this way: an epidemic is a natural proving of a nosode. Morbillium is the nosode of measles virus, and if you want to read symptomatology of morbillium, read several cases of measles. You want to read about typhoidinum nosode, you read several cases of typhoid. You want to read tuberculinum nosode, you read its effect of several patients affected with tuberculosis. You want to read the materia medica of variolinum, which is both smallpox and chickenpox virus. Read about the effect of smallpox disease and chickenpox disease on individuals. So Herring put it in nutshell. An epidemic infectious disease is the natural proving of a nosode. You give to 1,000 people morbillium nosode, and all people entered into proving, and the proving will contain measles symptoms on large number of individuals, plus depending on that individual susceptibility, they will have additional components. Okay, so that is the saying by Herring, and therefore, while using a nosode, from whatever patient says, you take a cluster of symptoms that are most likely by that infectious illness, the chance of success is more. We'll see. Eclampsia. When one of our doctor friend was delivering a lecture to a group of ladies, and I suggested you talk about pregnancy, conception, labor, postpartum, infancy to them, and what homeopathy can do to them. So homeopathy has a wonderful role in conception, entire pregnancy, delivery, postpartum, lactation, and infant care. One example is eclampsia, and the remedy given here is thyroidinum. Here I want to ask all of you, the childbirth is physiological or pathological? The process of child being propelled out of uterus to the outside world. You can unmute and tell me whether it is physiological or pathological. Childbirth, the process of labor. Swallowing food and water is physiology or pathology? Breathing in and breathing out air, physiology or pathology?
So Dr. Kalpana and Dr. Benasir has mentioned it as physiological, sir.
So it should be accompanied by pain or no pain? In a physiological process, swallowing, if it is painful, it becomes pathological. Breathing, there is discomfort, it is due to pathology. So labor is labor or labor is labor pain?
Answers from Dr. Aishwarya and Kalpana ma'am has mentioned no pain.
Okay, so let us read our obstetric books little more critically and carefully. It describes stages of labor, labor 1, 2, 3. And what happens in 10 months of conception, the moment the ovum gets fertilized, the entire body makes a programming of what to happen in next 10 months. The very moment the ovum is fertilized by the spermatozoa, the entire body recognizes the process and there is a programming. And what happens in 10 months? The changes in uterus, cervix, the vagina, pelvis, the pelvic bony skeleton structure, muscles, ligaments, and the supporting muscles of back and abdomen. All these things undergo gradual changes, and at the end of term, the membrane ruptures, the fluid spill, the child comes out. Fatak. Like we chew, swallow the food, it goes through the throat, esophagus and falls into the stomach. We feel it till it crosses the throat and mouth. We don't feel the pain. When we feel the pain, we should be cautioned that there is something wrong. So pathology means not necessarily a structural pathology, it could be functional abnormality also. The muscles are not adequately relaxing, something is not okay. Therefore, what should have happened to the muscle in 10 months? It has not taken place. What should have happened to the pelvic girdle? In 10 months has not taken place, so there is dystocia. So we should understand that. Okay, so we have to monitor from day one and support accordingly so that the labor is a physiological process and it just happens even without homeopathic support. Don't claim superiority that the labor was normal with homeopathy. There was problem in the patient, you supported with homeopathic remedy on indication, the role is over there, then the system pulled the child out, pushed the child out normally. Okay. So eclampsia, thyroidinum is one remedy. Next slide.